How are you doing today?
Good, how are you?
Good. I'm Asa, and I will be your student nurse for today. We're going to do a general assessment real quick. We've already taken your vitals, so it's just going to be head to toe real quick. Give me a second. I'll go wash my hands, and I'll be right back. All right?
Okay.
Provide privacy. Okay. So like I said before, we're going to do a general assessment. It's going to be head to toe, no longer than 10 minutes. I'm going to give you some privacy. Okay. First thing we're going to check is your eyes. If you could, look straight at the corner of the... Before we start this, I'm going to check your ID bag. So, ID tag. If you could tell me your name real quick.
Cody Ryan.
And your name, or your date of birth.
11/03/90.
11. And do you know where you're at?
Rasmussen College.
Do you know what date it is?
July 16th.
7/16?
July.
July 16th, sorry, I said 5. Okay, so patient is oriented to person, place, and time. So our first test, we're going to look at your eyes. If you could take a look at the dry erase board.
Okay.
All right, you could keep looking at the top of the dry erase board. And look at my finger real quick. All right. Patient's pupils are equal, round, and reactive to light and accommodation. Patient's facial features are symmetrical. His eyes have no excess redness, no extra exudate, no discharge from the nose as well. His ears have no extra cerumen and no lesions. If you could please open your mouth. Mouth appears normal with no lesions in the mouth. There is good hygiene, and mucous membranes are moist and pink. All right. I'm going to test your hearing real quick. I'm going to whisper something, and you just repeat it back.
Dog. Cat.
Okay. Patient's posture is normal and correct, and his overall hygiene is appropriate. I'm going to check your lungs real quick. Before I do that, I'm going to check your spine. Right. Please bend forward for me. Spine is straight, symmetric, and there are no deviations. All right. I'm just going to listen to your lung sounds real quick. So each time I move my stethoscope, if you could, just take a deep breath in, okay?
Okay.
Go ahead. Patient's lungs sound clear, no wheezing, no bronchi noises. Respiration rate is normal, not shallow or very deep, but symmetric and such. I'm going to check your heart real quick. At the second intercostal space, listening for the aortic valve to the right of the sternal border. Checking the pulmonic valve in the second intercostal space to the left of the sternal border. I'm at Erb's point, which is the third intercostal space to the left of the sternal border. At the tricuspid, at the fourth intercostal space to the left sternal border. Check the mitral valve, which is at the fifth intercostal space at the medial clavicle line. Patient's heart sounds normal except for a third bump. Patient's skin looks normal with no lesions and no striations and no abrasions. All right, so I'm gonna have you lay down real quick. I'm gonna check your abdomen. I'm gonna palpate for any kind of distension. There you go. Okay. So patient's abdomen is flat and no barrel chesting, and there doesn't seem to be any distension of the bowel. I'm going to take listen to 4 quadrants. Sound normal. No hypo or hyperactivity. Just palpate. Are you in any pain? No abnormalities in the abdomen? Okay, while you're laying down, I'm going to check your capillary refill. Get your fingers quick. Capillary refill in the fingers is normal. All right, if you could sit up for me. All right, so we're going to do a little bit of range of motion. Maybe. All right, so if you could stand up for me. All right, I need you to touch each ear to each shoulder. All right. Put your head up as high as you can go. Look down as far as you can go. All right, hold your wrists up. Just twist them around. Put one arm each shoulder simultaneously. All right, both arms in the air. All right, hold your arms like this. You're going to do strength test, so when I pull, I just want you to resist. When I push, I want you to resist. Okay. Go ahead and kick your legs around for me, just to get your hips moved. To the other. All right, and you could walk 5 steps that way. and walk back. Patient's gait is normal, even, and smooth. Can you put your feet together for me? Close your eyes. All right, thank you. You can have a seat. Patient has no sway and his equilibrium is correctly balanced is good. All right, so I'm just going to check your legs and palpate your tissue for edema. His tissue feels normal with no excessive swelling. Okay, so we're going to do same with your arms, or we're going to do your legs.
Okay.
You just push against my arm. There you go. Squeeze in. All right, same with your arms. Put your hands like this, please. All right. I want you to push against my hands. All right. I want you to squeeze my fingers. All right. Thank you. Patient's muscle symmetry is normal and appropriate for age and height. And strength is appropriate, and there's good reflex. All right. If you could, I'm going to also check your leg strength. Put my hands down here. You're going to push for me. All right. I'm going to pull. You resist. Okay. I'm also going to, if you check the strength of your feet, if you could pull up and push down against my hand. All right, if you could lay back a little more, we're going to check your pulses. Check your brachial pulses first. Pulses. Check your dorsalis pedis. Dorsalis tibialis. Pulses are strong, not bounding, and not weak, at about a 2+, and they're symmetric and equal strength. Going to check the capillary refill in your toes. Okay. Now we're going to do check your face for your sensory perception. If you could, close your eyes. I'm going to touch a part of your face and you just let me know what part it is.
Right. Left. One. Two.
Okay. Just going to check your temperature on the overall of your skin. Patient's temperature is normal, no excessive heat or cold. Patient's facial sense is correct and appropriate. You could sit up for me one more time. Just going to check your carotid. Maybe. Patient's carotid pulse is equal strength at 2+, and symmetric as well. Okay. Are you in any kind of pain?
Nope.
All right. Are you comfortable?
Yep.
All right. I'm going to go document my findings. I'll wash my hands real quick, and if you need anything, you let me know.
Okay.
All right. Right for privacy. Did I forget anything? Did you know?
Well, when I went to the bathroom, I don't know. Did you do like
Yeah, I don't know.
this?
I was
Stick your
trying,
tongue
when you
out,
were over there, I
puff
was
your
trying to.
cheeks?
I did the buff the cheeks and I did the raised eyebrows, correct?
Okay, I must have been in the bathroom.
I don't think you did on the video.
No?
On this one, no.
It's good, like that we
Forgot nose, eyebrows. It's the easiest thing. It's the face. Why
I
would
think
you?
Captain's head was cut off
That's the only 3 things that I've seen.
in the camera when he got up. But I saw you do a lot, but I went to the bathroom, so I don't know if
What do you think? I mean, I got it stopped. I could probably. I mean, it's weird now that I've turned it off. And that's just it. I probably couldn't.
But can't
Slice
you
it
like
in.
slice from your first one to your second one?
I think so. I can try that.
Slice that part and then put it in this. Because you did like everything. But she said you can send her a couple things you forgot.
I know. I just don't want to send her like I missed like 3 things of his face. You know, like I missed him raising his eyebrows, puffing his
Well,
cheeks, and
she said
nose.
if it was like something like, you know, they wanted to know, then they'll ask.
To redo it or ask you.
Well,
They'll
they'll
pull you
pull you
aside and be
aside and be
like-
like, hey,
I just
so
submitted. Other than that, you did good.
can you check
I just
the,
submitted 3 things down.
show me how you would
So
assess
say,
Yeah.
what? How would you assess someone's nerve impulses didn't work right? And then you'd be like, oh, puff the cheeks,
Yeah.
raise the eyebrows, make
raise
sure that
eyebrow.
there's sensor.
All right. So I'll go over and I think I'll probably just send it because 17 minutes. Holy crap. Well.
The
Yeah,
one, the
the
ACI
tables
one
aren't
was
in
like
the-
16 minutes.
Yeah, we had to move them for a game we played earlier
They're
today.
gonna be like that for class.
Y'all are in fundamentals. Yeah. You'll do a game.
So they'll be like, you'll need them like that.
With candy, and y'all are lucky. Y'all get to eat the candy.
Eat them because
Yeah, we didn't
she
get
only had
the
one
candy.
We had to save them for you guys.
We're gonna save it for you guys. She
I
told us we
expect
could
a
eat
little-
Starburst and said, never mind,
I
we'll
expect a
give
little
them back.
kickback.
Yeah. Pass it on. Pay it forward.
Whose phone is this?
Probably mine. Mine.
Oh, it's good.
Why?
We were just sitting here and it wasn't mine.
If you want to find someplace you want to do yours.